What's up, guys? Welcome back to another episode on the show Behind the Scenes in Hell with Dr. Ron. And if you're new to this channel, my name is Ronald, and I talk about everything healthcare, health tech, and in between. If that's the kind of content you signed up for, yeah, you're in the right place. So please hit the subscribe button. And to my returning viewers, subscribers, thank you guys for sticking around and helping the channel grow. So, in today's episode, I'll be talking about a specialty in medicine that you might want to consider if you don't want to do the routine specializations, all the whole ups and gynae, surgery, medicine, and all of that. And that specialty is occupational medicine, right? So, yes, a lot of physicians are in occupational medicine, and it's not an area that is just reserved for physicians. Nurses can also get into occupational health, pharmacists can get into occupational health. So, it's really a field for everyone who is looking to try something else outside, beyond the bedside, really. So I'm going to walk you guys through the steps required, what the day-to-day looks like, how much you're going to be earning, and probably what the career options look like. And yeah, you might just want to stick around till the end of this video to get all those wonderful insights. So without wasting time, so what's occupational health? Occupational health basically is a branch of medicine that deals with prevention and treatment of job-related illnesses, really, and problems and injuries. That's basically what occupational health talks about, or occupational medicine. You usually hear the terms about occupational physician, occupational doctor. Basically, they are the same thing, and this is basically at the high level what they do. They are worried about how do we prevent workplace injuries, what policies are on ground to make sure employees don't get harmed while discharging their day-to-day duties and all of that. Right. So how do you start that? It's good to know that, again, I keep saying this. There are a lot of transferable skills for a doctor, a nurse, or pharmacist, or any healthcare professional who is looking to pivot, uh, especially the transferable skills. Talk about communication skills, you talk about collaboration, you talk about teamwork, interpersonal skills. These are all skills you can move from your current role into occupational medicine. So basically, if you want to get into occupational medicine, you need to check yourself. Are you someone who is interested in workplace safety? Are you interested in employee well-being in terms of making sure they are safe at work and all of that? So if this is you, then you might, find some joy working in the occupational health space. So once you're convinced that, yeah, this is the right path for you to tow, so it's quite relevant or important, you should consider getting additional training or certification or education in occupational health. And typically, most people will opt to go for a master's degree in occupational health. That'll actually cost you some money. But again, if you can't afford that, there are other, courses you can take in the interim and, find yourself in the occupational health space, maybe as a safety officer or whatever. So, but bottom line is you need to start taking additional education or courses around occupational health. So by the time you're done with that, I mean, this can also go hand in hand when you're doing the education. You want to look to gain experience in that space. So it's either you're looking for internships or you're volunteering in organizations or you're looking for fellowships to learn about occupational health or occupational medicine, really. And another way to also get hands-on experience is by actually doing the work itself. So, for example, if you work in a hospital, you might want to work in or with the hospital team to develop sort of a safety protocol for, maybe if identify the problem in the hospital, you think this is a big issue that should be addressed. So you could actually develop a safety protocol to help mitigate those things and train people on how to work better and safely. So while you're busy gaining experience, at the same time, you're trying to network, you're trying to build connections, right? So you want to join associations, occupational health associations. There are a lot of them on LinkedIn. You want to join them. You want to attend conferences. You want to attend seminars, webinars, workshops. Some of these are free. Some of them are paid. But I mean, It's just to give you an idea of what's happening in the industry. Who am I going to connect to? Is it who is who? Who should I be talking to? Who should be mentoring me and all of that. So that's the idea behind all of those networking and attending conferences, right? So when it gets to the point you think, yeah, you're good to start applying for the jobs, or maybe you'd have done that, you want to tailor your CV to reflect occupational health experience, really. So basically, all those activities that relate to occupational health. So, for example, you're a clinician, you're a medical doctor working in a hospital. Probably you've sort of worked on projects to improve occupational well-being in the workplace. So those are the kind of things people want to see on your CV when you're looking for those kind of roles. Then you now start applying for the roles. LinkedIn is a good place to use in terms of applying for occupational health roles. It's just for you to type in the word occupational health, check the jobs, and there are tons of them. You can set your location based on where you are: Nigeria, UK, US, Canada, Australia, wherever you are. You will see the jobs and you get to apply for them. Then, yeah, you go for your interview, you land the role, and you start working, right? So that doesn't stop there. You also need to, keep yourself updated about current trends in the industry, changes by still attending conferences, reading relevant journals. I mean, you could also get to publish your own papers in reputable journals and all of that. Interestingly, you can also specialize in occupational medicine. That's funny, but that's the truth. So you could decide to say, okay, I'm going to be working on strictly industrial hygiene. I could decide to just be talking about environmental health, or you could say, okay, I'm going to focus on the aviation space or the finance space. I mean, so there are tons of areas in which you could specialize as an occupational health care professional. So that leads me to the next point. I get this question. So where can I work? I mean, you can literally work anywhere, because you're just looking at where people work. How can I make those places safe for them to work? Injuries, preventing job-related injuries, occupational hazards, and all of that. So anywhere there are people, you can actually work there. Right. So we're looking at the field of the healthcare space, you're looking at the field of the aviation space, you're looking at education, you're looking at law, looking at finance, you're looking at technology. So the opportunities are actually very endless. So how much are you going to earn? So as at the time of me doing this video, I checked online and it said in the US you get to earn as an occupational health physician. You're looking at an annual salary of about $267,000, and in the UK you're looking at about £91,000 per annum, or about £46 per hour. So which is really not bad, honestly. And yeah. So I also looked at what the NHS has to say about occupational health. Let me see if we could just pull up my screen in a second to just show you guys what they're talking about. Yep. So this is what the NHS is talking about of around occupational medicine. So let me just go down here. So like I said before, you just help people stay at work or return to work after accident or illness. And you have a very key role to play in helping people to prevent illnesses or injuries caused by work. And being somebody from the healthcare background, it gives you a lot of influence, really, because from the clinical background, it comes in very handy. So you combine that with a detailed understanding of employment and anti-discrimination legislation, as well as environmental and health and safety law. You could work in the NHS, work in telecoms, car manufacturing, energy, emergency repatriation, armed forces, transport organizations. I mean, so you see all the area of places someone could work with, in the occupational health space. Then your day to day, basically, you looking at you deal with a range of clinical issues such as physical factors, which could be things from infection materials, radiation exposure. It could be things around psychological behavioral issues, which could be around PTSD, occupational burnout, depression. Then you can also look at the non-clinical part of the work, which is related to creating policies, developing guidelines. So I mean, it's very, very varied. And you also have the opportunity to also go into teaching and education, right? Um, so yes, I talked about this, about your salary. So entry level, you start at £40,000, which can increase up to 84,000 and up to 114,000 as a consultant, right? So I already talked about the skill set, the transferable skills. So I talked about communication skills. You need to be emotionally resilient, teamwork, problem solving, innovation, creativity, outstanding organization ability, and very effective decision making skills. So those are some of the things. Yeah, I just pulled that from the NHS to actually show you guys that I mean the opportunities are there. They are very numerous. So it's left for you to take the opportunity as it presents itself. So if you're somebody who is looking to go outside the bedside, then occupational medicine is something you might want to consider, right? So that's it from my end today. So if you've enjoyed this video, please give us a like. Um, Subscribe to the channel if you've not subscribed. I looked at my analytics. I see that most people who are watching my videos, they are not subscribed to the channel. So please subscribe to the channel. Don't leave without subscribing to support the good work we do here. Share this with your friends and family. And yes, I'm planning to bring in an occupational health physician over the next couple of days. I'm yet to confirm that. So you might just also want to stay tuned, subscribe, and turn on notifications because it's going to be an interesting interview with these physicians who are in occupational health. And they'll be sharing their journey on how they actually got to where they are. And hopefully that's going to inspire somebody to get into that space. So thank you guys once again. And until I see you in the next episode, I still remain your host, Dr. Ron. And bye for now.